COVID changed everything. We speak in pre-COVID and post-COVID terms. Who knew that 2019 would be such a baseline year? Return to substance use, overdose death rates, an unparalleled impact post-COVID. The national overdose deaths increased over 30% in 2020 compared to 2019. Many would argue we're not past COVID today. And COVID also impacted the drug testing landscape. Utilization of drug testing changed, positivity rates changed, substance use changed. But what didn't change is drug testing laboratories are still a key partner in optimizing patient care, and drug testing data is a crucial component to be more informed when caring for patients, arguably now more than ever in today's world. Drug testing insights can provide meaningful trends in adherence and substance use in real time, data that can be used to better care for patients, strengthen harm reduction strategies, and ultimately help save lives. If we together can improve a patient's odds for success in recovery by knowing that they're progressing through treatment, flag when they're at greatest risk for poor outcomes, we can make an impact at the patient level. And the more patients that are impacted, the more effective a treatment program, the stronger the community, and the closer we get to our collective mission of saving lives. We're going to be highlighting some meaningful trends revealed through drug testing in the state of Oregon, diving into the county level, the drug class level, and patient level. Most importantly, how do we integrate these data-informed insights gained through drug testing into treatment protocols and improve harm reduction approaches? So here's what drug testing looked like pre and post-COVID in the state of Oregon. This data represents all samples that were tested by Cordant from behavioral health organizations in Oregon. By behavioral health, we mean abstinence-based programs, medication-assisted treatment programs, mental health programs, and the majority of these patients are actually coming from abstinence-based treatment programs. To orient you to what you're looking at, the gray bars represent testing volume quarter over quarter, and you can see that evident and dramatic drop-off in Q2 of 2020 as the state of Oregon began to shut down in response to COVID. At the same time, you can see the red line, which represents unexpected positivity rate, or you could think of it as substance use. It's excluding any results that correlate to a prescribed medication and any positive results for medications for substance use disorders, methadone, buprenorphine, naltrexone. So all of the other positive results are what is summarized with this red line. And you can see at the exact same time those gray bars drop off in Q2 of 2020, that red bar jumps. The pre-COVID unexpected positivity rate was around 30%, and post-COVID, we're up closer to 40%. And interestingly, once that new watermark was set, around 40%, we stayed at that elevated level, even as we start to see the testing volume trickle back in. This data set does include THC, and THC is the most frequently positive drug that we see across Oregon. So if you remove THC and all those samples that were only positive for THC, that red bar drops, but the trend's the same. You go from about 30% unexpected positivity pre-COVID to 17% if you remove all the THC positive samples. And then after COVID, you go from that 40% down to 26%, removing those THC positive samples. So excluding any positive result that has to do with a prescribed medication or a medication for SUD and THC, after COVID in Oregon, patients in behavioral health programs, 1 in 4 samples tested positive for something unexpected. So what can we do together to leverage drug testing insights and lower that red line? To start to dive into the next layer, we look at the county-specific substance use rates. The left side, this is publicly available data from OHA that details drug overdose deaths by county in 2020. On the right-hand side, this is Cordant test data from the first 3 quarters of this year, where we see the highest rates of substance use in Oregon. There's a lot of overlap between these two views. Multnomah County is the #1 on both sides and a significant frontrunner on both sides. What's different here is there's 2 years between these visuals. Drug testing insights are real time. If leveraged in a way to impact patient care and treatment protocols, it can enable a proactive approach, especially when data is presented in an actionable way. So again, in Q2 2020, we saw over a 50% decrease in drug test utilization, and that jump up in unexpected positivity rate 10 percentage points. Why? Diving into that drug class level starts to give some of that insight. And on the left-hand side, you can see the different drug classes that we tested for this data set in Oregon. Green is not necessarily good and red is not necessarily bad, right? 2019's become this baseline year due to COVID. So that green 2019 column is really our pre-COVID standard, and this new normal it's created. The redder the color, that's where we see the most significant growth in positivity rate. And majority of this growth is aligned with that Q2 2020 drop off in testing and increase in unexpected positivity rate when COVID shut down much of the state of Oregon. Looking at the drug class individually, fentanyl jumps off the page. Just that steady growth from green to orange to red. 1.5% positivity rate in 2019, up to 3.1%, doubling, more than doubling to 8.3%, and nearly doubling again this year to 14.6%. Amphetamines as well, the third line item, jumps off the page. Primarily, this is driven by methamphetamine use. And many times you'll see, and we'll dive into it a little deeper later, that fentanyl and amphetamines are concurrently positive in the same samples. On the right-hand side, this details the top 3 most frequently positive drug classes by county in Oregon. THC takes the top spot down the line. But if you start to look at fentanyl and the 3 counties where fentanyl pops up in the top 3, it's really starting to creep in. And where we really see that is if you exclude THC, since it is that number 1 most frequently positive drug class, fentanyl pops up as the next most frequently positive drug class in all of these counties except for 1. So how do we get to nearly 15% positivity rate for fentanyl this past quarter? Looking more granularly, the 14.6% positivity rate in the first 3 quarters of 2022 was actually 11.4% fentanyl positivity in Q1, 13.1% in Q2, and 17% in Q3. This rise in fentanyl positivity we see in Oregon and we see across the nation is not slowing down. And what's real interesting is only 45% of these samples from Oregon had fentanyl testing ordered. And that means there's a significant number of people out there who would test positive for fentanyl if they were tested. And you don't know what you don't know. We also looked at fentanyl drug use by county in Oregon. And again, Multnoma's substance use rate, they were the number 1 most highest county for unexpected positivity rate, and it's primarily driven by fentanyl. Only about 40% of the samples from this county that we tested had fentanyl ordered. Jackson is the 2nd county on this list for fentanyl positivity rate, and we only tested 5% of samples from this county for fentanyl. Again, significantly more patients could test positive for fentanyl had they have been tested. And that could significantly impact treatment decisions, protocol adjustments, risk assessments, if fentanyl had been tested and had been identified. And that's the importance of testing for fentanyl, right? It's provider awareness, patient awareness, harm reduction, saving lives. Many times patients don't even know they're consuming fentanyl. It's unknowingly present in another drug of choice. And if not tested, they don't know it's there. The provider doesn't know it's there. And there can be a whole harm reduction strategy built around that insight. As alluded to earlier, vast majority of the time when we see fentanyl test positive, something else is there as well. And in fact, in this Oregon data set, 4% of the samples that were positive for fentanyl were also positive for another unexpected substance. And most of those other substances were amphetamines, primarily due to methamphetamine use, 54% of the time. 26% of the time, there was also a pharmaceutical opioid present with fentanyl, and that's morphine, codeine, hydrocodone, hydromorphone, oxycodone, oxymorphone, noting that the morphine could be due to heroin metabolism. And then we start to see this trickle of cocaine concurrently positive with fentanyl 5% of the time. And just to kind of get you to think a little differently, you may have a patient who's consistently testing positive for methamphetamine. It could be a known drug of choice, self-reported, that it's been confirmed through drug testing. But what if fentanyl's also there? And as a provider, you're unaware, the patient's unaware. Would this added knowledge change your approach in treating a patient, change the patient's view of amphetamine use? Maybe naloxone could be offered. A lot of decisions could be changed or impacted with the knowledge of fentanyl. Fentanyl's a big focus area, but another area where COVID has had a significant impact is the mental health space. Specifically in Oregon, we've seen 1 in 3 samples where a mental health medication was reported as prescribed test negative for that respective medication. A big uptick in non-adherence to mental health medications has been seen across the country. Specifically in Oregon, we see an increase in utilization of testing in the mental health space. And you can see that increase from 2020 to 2021, and again, just the first 3 quarters of this year. You can also see the spike in non-adherence rate as the testing increases. I want to point out the antipsychotic and anti-epileptic non-adherence rates. These medications are primarily prescribed chronically as they're treating chronic conditions. And we see a 45% non-adherence rate for antipsychotic medications and a 31% non-adherence rate for anti-epileptic medications for the testing data we have for these behavioral health patients in Oregon. Drug testing is an invaluable tool as it provides real-time analytics to be data informed in how we think about treatment plans, harm reduction efforts, optimizing patient care, and improving a program's effectiveness. But how do we do that? How do you take the insights from drug testing and drive change at the patient level? We're going to highlight the utilization of our risk assessment algorithm, which feeds into our result management reporting tool. And this data set uses our lab testing data to track testing protocols and flag patients who potentially are at the greatest risk for poor outcomes based on the results of their lab test. And what you're looking at is a snapshot of Cordant's result management report. This report is our most widely utilized data set across our behavioral health clients in all 50 states. These reports are sent out on a weekly basis, aligned with when the programs we work with are holding their weekly staff meetings. This data is presented in an actionable way where we're able to highlight a patient's test frequency and help monitor program-specific testing protocols. This report also has a patient risk assessment built in that, based on the lab testing results, stratifies patients into a 4-tier structure. Stratifying patients on their risk for poor outcomes, as demonstrated by their lab testing results, helps to focus efforts and attention on the areas of greatest concern and help direct patients potentially falling back into substance use or polysubstance use or non-adherence. Get back on the right track. And the beauty of this data set is it can also be used to demonstrate program effectiveness. Specifically, if we look at the 3 counties in Oregon that showed a higher than average overdose death rate in 2020, Multnomah, Lane, and Josephine, and we isolate all of the testing data that we have at Cordant. We put this information into the result management report risk assessment, and we get a risk profile for all the test data we have in these 3 counties. On the right-hand side, you can see this past September, nearly 60% of these patients fell into our low risk category, meaning the samples tested negative and there was nothing that should have been there medication-wise, or all medications reported as prescribed were detected. 24% fell into the medium risk criteria, and this is primarily THC use. That leaves about 17% of patients at the highest risk for poor outcomes and enables a very targeted approach. Directing focus to these patients to help them drop in risk level, ensuring that the other patients that are in the low and medium tiers maintain that risk level, helps to drive a more effective program. And what's really important to note is treatment works. Keeping in mind this data for these patients are those who are in treatment, being tested by Cordant in the 3 counties that had the highest unintentional drug overdose death rates in Oregon. And 80+% of them are in lower risks for poor outcomes based on their lab testing data. Here's another example of how this result management report data is used today. On the left-hand side, we're using this risk stratification data to demonstrate that a program is effective. And again, red is not bad. We can never get rid of that red, that very high risk. We can shrink it, we can manage it, we can direct resources to it, but we need to be sure we're actively monitoring it and able to make an impact where it's needed the most. And you can see here, if we isolate the first 30 days of testing for a patient population, there's a decent amount of patients in that high and very high risk bucket, that orange and that red color on the pie chart. But after we test these patients, get them into the program, we see a reduction of that 34% of patients in that high risk bucket to 18%. And that reduction in high risk and increase in more low risk is exactly what this data enables. On the right-hand side, we're looking at highlighting this testing data to visualize a patient's treatment journey, and doing so by categorizing their drug testing results, test date after test date, into one of these categories: low, medium, high, or very high. And we can provide this data over large periods of time so our clients can demonstrate their patients are getting better. And And you could see here exactly what the summarized results were for each test date for a given patient and what the corresponding risk assessment was. We are a proud partner of the Oregon Council for Behavioral Health and grateful to have had the opportunity to share our drug testing insights and reporting tools with leaders in the behavioral health space in Oregon. And having real-time access to drug testing insights presented in an actionable way allows for a proactive approach and helps give patients a greater odds for success. Cordon's committed to providing drug testing services and giving access to data that helps our partners be more informed, intervene early and appropriately when needed, and ultimately improve patient outcomes. Now, our lab and pharmacy services are geared to support harm reduction efforts and further the collective mission to save lives in the communities we serve.